Hello everyone and welcome to our webinar. My name's Karen Boness. I'm the Marketing Manager here at Manage My Health, and today I'll be the webinar moderator. The title of today's session is Resetting Your Practice and Adapting to Meet the COVID-19 Challenge. So we know that coronavirus has changed the way that many practices operate and seriously impacted profitability for many of us. So today we're going to explore how to adapt and thrive during these changing times, because it certainly looks like the virus is here for the foreseeable future. So we really need to adapt and change some of those business practices and business strategies that we have in place. So to help us to navigate this important topic, we've invited health business strategist and consultant Hanya Oversby to share her insights and tips. So I'm really thrilled to welcome her today. Hi, Hanya.
Oh, hi, Karen. Thank you for inviting me along today.
And thank you for sharing your expertise with us. Now, unfortunately, our usual MedTech presenter, Ben, can't be with us today, but we're lucky to have another of MedTech's experts. And for this session, we've got Igor Pinero. Hi, Igor.
Hey, thanks for having me.
Okay. So that's your team for today, everyone. Now, let's get started with a quick look at the agenda. So we're going to kick off with in about 1 minute with Hanya, who's going to share her tips to reset your practice. And then we'll pass over to Igor, who's going to talk to us about how we can harness technology to manage your GP management plans and your team care arrangements more effectively. Now, as your webinar moderator, it's my role to take care of all of your questions. So if you have any, please send them through. I'll answer them as I go. If there's any that are particularly directed to Hanya or to Igor, I'll hold those over to the end, and we'll do questions either through voice. I'll be able to let you speak, unmute you, or if you prefer just to type them, that's fine as well. So we'll tackle that when we get to it. But otherwise, I'm really pleased to welcome Hanya. Hanya Oversby is a business advisor, business consultant, educator and facilitator with extensive experience in the successful establishment, management and guidance of healthcare businesses. Hanya and her team at Health Business Network design agile business strategies and procedures for healthcare providers who want to explore actionable options, understand potential pathways for development and achieve demonstrable growth. So I'm thrilled to welcome Hanya today. Thanks, Hanya.
No, thank you.
So if you just want to share your screen with us, that would be wonderful so we can see your slides.
Brilliant. Thanks, Karen. Thanks for the lovely introduction. I'll just share my screen. Okay. Bring that up. So Karen, I'm just confirming that you can see my screen.
Yes, I can. Nice and clear.
All right. Fantastic. Well, we'll start with today's presentation. So as Karen mentioned earlier, the focus on today's presentation is about the business reset, post-COVID-19 planning, as things have changed dramatically. My name is Hanya Oversby, and I'm one of the directors of Health Business Network. So Health Business Network is a national consultancy. As a business consultancy company, we work with our clients to plan and create bespoke business development strategies and plans for our clients to have more business clarity. We provide targeted growth strategies. We help you create value in your business. And I'll explore what that means a little bit further on in the presentation. We work with our clients to create a practical and actionable plan for the future. We streamline your business practices and support and manage your team to do the best work, and work with you to take you and your business to the next level. So I've been in this space since 2001. And I have a business partner in Sydney. I'm in Melbourne, Australia, Russell Lee. And so it's very exciting for us to be working with private healthcare clients all around Australia. But today we're covering off COVID-19, the great disruptor. So what we found in 2020, we find ourselves amongst very, very trying times. And I'm sure that's not news to any of you because you're living it at the moment. This is happening to us both personally and professionally. Even though the disruption of COVID-19 may seem threatening, and it was a whirlwind early on, it has forced most of us and our businesses to look at our businesses in a different way. Now, this is nothing new. Historically, this has happened before to businesses around the world. You know, during the Great Depression, people had to rethink how they had to work to get out of that, and some great companies were born from that. The introduction of the internet, that's a disruptor, and people had to change on how they worked in their businesses. Even with surgical practices, you know, devices were invented, technology or devices where surgery was no longer needed. People had to think about, wow, what is the service now I'm going to provide? So it's with that sort of viewpoint that we've looked at COVID-19 as a disruptor, and we've been thinking, what is it, our opportunities to move to the next step? So we've been working with COVID-19 as a catalyst for change. We've seen it as an opportunity for our businesses that we work with to take stock and review the key areas in your business that need reviewing. So working with our practices, we look at the practice historically. Where has the practice been? So we'll look at all those things at your practice in the key areas. We look at your vision and mission, the why, the what and the why you're here. And then we see, is the vision and mission that you have originally established for your business, is that still the same? And is it going to suit the practice moving forward? Next is the structure of your business. How are you legally structured? Are you set up for growth? Do you have are you set up in a way that there is an opportunity for a growth strategy with your business? And most importantly, working with our businesses with the structure, we've always got to look at the structure of your business with the end in mind. How are you going to leave your practice, sell out of your practice, or sell your share of the practice? What is that structure, and is that structure something that's going to hold you in good stead moving forward? Your business goals. Your business goals pre-COVID, and what we're finding with a lot of our clients, have changed. The business goals that a lot of our clients have had were based on how medicine was being delivered pre-COVID. But COVID has been a massive disruptor. It's clearly shown us where there has been holes in our business goals and structures, because a lot of us have found ourselves being left vulnerable in our businesses due to what COVID has done to us. But we've been working with our clients to work our way through that. The organisational structure. What we're finding in working with a lot of our clients is a lot of the organisational structure has been based on what the practice was at a particular level. But we need to look at your organisational structure and plan for the future, for the growth strategy, and what does it need to look like. So with the organisational structure, we're very careful to look at what your organisation is now, not look at your organisation on who are the people you've got in there at the moment, but taking the people's names completely out of it and looking at what are the roles we need at our practice to make our practice successful. Then we look at your team and say, where does that current team slot into what our business needs? That is very, very important for the reviewing your business for moving forward, especially post-COVID, as the way we're delivering medicine is going to change. Also looking at our businesses, we look at your key performance indicators and review it. What are the important KPIs? How have they performed to date? We look at the snapshot on how are you performing now, and what do we need to do and plan moving forward? So when looking at those KPI and those key business areas, we look at the key existing business practices in the key areas of financial. So in financial, we look at metrics from your practice management software and your accounting software. It's very important to look at both those metrics to see how you're traveling in your business. Historical information from both these practice management software and your accounting software tells us a lot about your business and how it's performing. And in fact, that's one of the most important things that we need to look at for planning for the future. The clinical services, we have a good look at what clinical services have been provided at your practice, which have performed well, and which need to change or be delivered differently moving forward. Associated services involved with your practice. Are there allied health providers? Is there a pathology at your practice? Radiology, pharmacy associated with your practice? How are all those associated services working with your practice? And what is your relationship with them? And how does that need to look moving forward? Do you sell products at your practice? If you do, how is that going? If not, is that an opportunity for you? A review of your technology. We'll have a bit of a more closer look at that in this presentation. Marketing. What was your marketing plan pre-COVID? What did it look like? And what does your marketing plan need to be now moving out of COVID? And once we identify what your practice should look like, how do we get that message out to the patients who need to come to your practice? And of course, when reviewing the existing practices, we need to look at where do you sit in the landscape? What are your competitors doing? What are your rivals doing? What are other industry leaders doing? And this is out of your location, maybe even out of your state. We might need to look at what's happening in the healthcare landscape locally, nationally, internationally. Everybody is in a very agile state with their businesses, and there's some really creative thinking out there. And there's a lot to learn when we look outside our own businesses to see what others are doing and how is it that we could bring this into our own businesses. So the key is planning for the future of business practice. So when working with our clients or our private practices, we need to assess the full suite of your clinical, administration and business skills available within your organisation. And we need to plan for the future, especially thinking, what if this happens again? Have we got the right resources in our business? Is there a redundancy in our businesses to cope with this should it happen again? Are we providing the right services? Do we have the right people? And is our business structured in a way to cope with this moving forward? And very important in terms of the planning for where are we going next is to develop a financial forecast. Because when working with our businesses, what you don't want to do is just to decide to go into another direction without properly planning on how would this look if we did implement this in our practice. The financial forecasts we look at where is our income going to come from how many clinicians or income generating staff members or allied health or third parties that are involved with our practice. If we do introduce a new service to our practice, how much income will that new service bring, but how much will it cost? Can we justify the cost of bringing that service in how we're structured now? Do we need to plan for the future and have a look at is technology something we can implement to help us bring this in a more cost-effective way? And also we need to have a look at what's happening outside the practice. What has been fast-tracked or introduced by the government or through your practice management software? What's now accessible that wasn't acceptable or accessible previously. What should we keep from what we were doing, and what should we introduce now that we can? What new markets will open up for us? We need to plan for the future, but that planning is critical at this particular point, because this is your point to stop, review, reset, and move forward. My opinion is that if you continue on as you always have, that you may be left short, because the landscape, the healthcare landscape, has changed and will change. We need to plan for the future. The patient expectations have changed. They've had a try of something in terms of video conferencing and telehealth that has given them access to medical practitioners that's very convenient. And there will be a want to still have an access to that. So we need to also look around us, look at how other industries and how are they planning to bounce back. Learn from other industries as well on how they've been agile and adapted to change. So what has COVID-19 taught our business in terms of use of technology? Well, what it has done, it's highlighted the importance of cybersecurity, and specifically for the healthcare businesses. We've had to liaise or communicate with our patients online. So we've had to really have a think about confidentiality of those interactions with our clients, and we've all had to think of this quite quickly and how this would work in our practice. But it's also showed us the importance for a business to be mobile and agile. And what I've heard a lot of feedback from a lot of practitioners is it's actually been quite nice to be able to work from anywhere at any time. It's given us flexibility. No longer has the medical practitioner had to be in a room in the practice to provide this service. How do we plan for this moving forward is what we've got to think about. So moving forward with technology, and you need to look at resetting your business for a fresh start. So the first start is to audit your technology. Looking at all the ways that we can service our patients and bring medicine to them in a variety of different ways now, you need to look at your technology and is it fit for this purpose? And will it support you for the next few years? Do you have security? And is it an asset or a liability? This is very, very important, because online video and telehealth will be a big part of your practice moving forward. There's no question about that. But you need to make it secure and an easy, accessible thing for your doctors, your staff, and for your patients. We need to review your workflows as a result of that, because there will be new workflows that the staff and yourself may not be familiar with. So it is a good opportunity to stop, take stock, and say, what services are we providing? How are we providing them? And how can we do them efficiently and effectively? And what technology can help me become more efficient? So, and finding the opportunity. How would this work within your practice? And will telehealth and video conferencing open a new revenue stream? Will this also open your practice up to patients that are not in your location? Will you be able to provide services that patients that can't come into your practice but could access your practice, that are either time poor or distance, have got distance restraints, can still have access to your excellent clinicians at your practice? This is quite a lateral way of thinking, because you've suddenly got the opportunity to access patients that you've never been able to access before. The busy executive from 9 to 5 that might not be able to come to your clinic could still now access your clinic, for example. Or patients in the rural area, say if you're a city-based clinic, that would like to access a clinician that has a specific subspecialty in your practice, then they can get to your practice via telehealth or video conferencing. The way to think about your practice is definitely changing. And of course, you need to plan for this, because is it worth that? Will I get a return on my investment for moving down in this direction? So with your tech, there's a bit of a checklist here for you to have a think about. Your remote Your remote access must be secure. Your telephone network must allow you to work from anywhere. And that's a big thing. Not only for you being able to access your practice, but also as a COVID plan, if your practice has to shut down, can your patients still access your practice through your telephone system? Telehealth and video conferencing, what platform are you going to use? Do you have the right security, compliance and identity management in plan? Team chat, have you got that set up well, as you might have staff and clinicians over many locations moving forward? How are you going to collaborate and communicate with each other effectively? What are the policies and procedures around this, around remote working policy and bringing your own computer and so forth? How are you going to minimise the risk to the practice by this happening? Or how are you, as a owner of a practice, ensuring the safety of your employees when they're not on site? Change management and workflow. Without the need to change your business, without it will not evolve. We're basically saying I would probably challenge all of you, how is your practice changing? And if it hasn't changed at all, why not? What is happening? It's probably something that you really need to consider and work on. And the data. You've got excellent data available to you. Get to know your metrics and make objective business decisions. And the data is coming from your practice management software and your accounting software. Metrics. I always say, and I'm not the first to say it, if you can't measure what you're doing, how do you know how you're going? So the metrics and measuring is very important into assessing how is your practice, what is the business health of your practice and how is it travelling? So the key areas that you need to be looking at is compare your patient numbers, services, service numbers and bookings to this time last year. When working with our practice, we like looking at your metrics month by month and also year to date, and comparing them, the same numbers year to date to the previous year to date. And looking at why some trends are happening, especially in the year to date numbers, as you'll start seeing patterns emerge, and then you can start planning for them. With the service numbers or item numbers and bookings, with all the practices that we've been doing business reset workshops with and resetting their businesses, there's been a big drop, obviously, or a change in the March in that March COVID 2020 going forward compared to last year's figures. But then working with them, we have a plan for growth. But unless you're looking at what's dropped off, what's been working well, and what kind of bookings are coming in, we need to plan for what your practice is going to look like moving forward. You need to identify which patients and services have remained consistent and which didn't work well in the crisis. And those that didn't, how could we give our patients access to them moving forward? We need to look at and benchmark the return on investment of telehealth, mobility and video conferencing. Can it or did it help your business grow? The investment of getting this set up at your business. Find data and opportunities to give you the targeted annual growth. And that's what is very important with the practices we work with. We do need to set targets. We need to say, for our practice to be healthy financially and be profitable, we need to say, this is what we need to achieve in the next month, quarter, 6 months, 12 months. So we all know where we're heading. And if we're not heading in that direction, we can quite quickly, with regular monitoring, say, why is this not happening? So we can be proactive into looking at our practice. What are the barriers, or what is working well, and what can we do to affect change? So for us, it's important to work with a business dashboard where we've identified all the key metrics or key performance indicators that are important to your business, and we're looking at that information regularly and easily. That's something that is key for us for the success of your business. Cybersecurity. So another key area that you need to think of, because a lot of the medical practices are moving on to online interactions. Having a cybersecurity strategy, firewalls, antivirus, the staff training and backups are very important. In fact, staff training is imperative. We need to keep our staff trained up, all of them, to the next change that happens at the practice. Because it's with many practices, things have been changing so rapidly. We need to ensure that the whole team is along with us on the journey. And invest in a secure file sharing system. So sending emails with clinical information is not worth the risk taking. You really should be transmitting patient information through secure file sharing. So have a look at your practice and look at your resilience to technology. So look at this checklist and say, how good are my backups at my practice? Will they work when I need them to? Do you test that? I've been at practices that we've come back to the backup, and unfortunately the backup, through some technical hitch, had been overwritten with blank, and so it was just backing up blank and blank the whole time. So we had to go back a week before we could get some information, and a week's worth of information was lost. So what is the policy in place or the procedure in place to ensure the integrity of your backup? How long will it take to restore your data? That's another thing. Some backups take up to a week to restore, or can you get instantaneous restoration? If you're a cloud user or someone with a server, how reliable is your system? Can you invest a little to make it more reliable? And are your staff capable of handling change? It's very important your staff are the key. The staff are the reason the practice runs. We've got to make sure that they're capable to handle the change, especially if they all of a sudden need to work off site or to work with a clinician that needs to work off site. They need to have an understanding how that can quickly happen and how the practice is running now. So that's our business reset. So we've been working with many, many practices in this way, and we've found that we're engaged by private practices to help them through that process. So it's not something that you need to tackle on your own. You can bring in or engage your trusted advisor, or you can work with us, obviously. And we are currently offering business reset workshops. We're doing them remotely via Zoom, and that's working very, very well, because that makes it quite easy for us to be able to work with all the key stakeholders at times that are suitable for everybody, virtually via Zoom, which works really very, very well. So I would like to just let you know of an offer we've got. Firstly, with Health Business Network, we do have a group called the Boardroom Connection that you can just join for free through our website on healthbusinessnetwork.com.au connect. And you'll become part of our network, which give you access to exclusive invites, discount to relevant education, meetings and social events. Or you could connect with us to find out more information about the Business Reset workshops workshop special offers. And what we've got on offer is a couple of our network partners have offered a comprehensive technology and audit 3-year IT strategy, and another of our network partners have offered a web and digital market review to help you hit the ground running. Now, those are complimentary offers. You're not obliged to take any of those offers up, but they're there for you. So probably the best way for you to connect for either the boardroom connection or any of the business reset workshop is to join through our website through the Connect form, or feel free to contact me directly. I'm more than happy to email or have a chat to you. Now, the other thing that is quite exciting, I need to draw to your attention, is I produced a podcast and I launched it in May this year, and it's called Dr. Diaries with Hanya Oversby. The podcast takes you behind the scenes of the intriguing medical world. I've invited guests in Australia and internationally who've taken us through their insights, experiences, ideas as an expert, thought leader and trailblazer. So from all different areas of medicine. So it's been fantastic and the response has been great. So to access the Dr. Diaries podcast, there's a link there to the Hanya Oversby website. You can listen on my website and find out more about me. Or you can just go into Apple or Spotify and pop in the Dr. Diaries and you'll be able to listen to the podcast. We're releasing new episodes fortnightly. And it's been very excited. We've got season 1 this year and we'll be launching season 2 in 2021. So Health Business Network, just going back to our business, we're offering the business reset workshops to new and existing clients. We can work with you virtually. So contact us directly and we'll be able to work with you to give you clarity on your business, to work on growth strategies and create value in your business. I did say I was going to say, what is creating value in your business? Creating value in your business is creating an asset that we can look to sell moving forward. And that, for some of you, is a concept you're quite familiar with, but some of you are probably thinking, is my practice something I can build up to sell? And that answer is yes, we can work with you in that way. We also work with you and your team to create a practical, actionable plan moving forward. We work with your management team in coaching and mentoring. And we work with you for the long term to take you and your business to the next level. So at this point, I'd like to say thank you very much for listening to my presentation. I invite you all to connect. I love to connect and if you've got any questions, but at this particular point, I'd say thank you for listening to the presentation. And Karen, I might hand over to you.
Okay, thanks so much for that, Hanya. That's given us lots to think about in terms of adapting to this new normal that we find ourselves in. Now we're going to shift gears a little and take a look at how you can harness technology to improve care plan management, which will, the goal of this is to keep a constant flow of patients in the practice, because we've really seen a lot that people aren't getting their regular health care and visiting practices, which is impacting many of our clients and hopefully not you too much. So Igor's going to present that for us, and I think he's the perfect person to do that because prior to joining MedTech and becoming one of our business development managers, he has had a few different roles as a practice manager in various different practices. So he's well versed on both sides of preparing GP management plans and team care arrangements. So I'm pleased to hand over to Igor Pinero. Are you there, Igor?
Yes, thank you very much. I'll start sharing my screen.
Thank you.
So, hi everyone. I'll just be introducing the MedTech and Manage My Health tools that we have available for practices. And just to put you into that perspective, one thing that helps set us apart from other PMS providers is that, and a point that I'll be referring back to during this presentation as we go on, is that we offer a customizable solution. This allows us to better fit your unique day-to-day needs because no two centers are the same. There's no center that's exactly the same as you. So you all have unique day-to-day needs, and we help to accommodate for those needs. Through our tools, we can help in improving efficiency, increasing profitability, enhance patient engagement. We have a number of features that can help provide a COVID-safe service, which obviously is quite pertinent nowadays. And we have a secure Australian-hosted telehealth service, which is very important. And as Hanya alluded to, it is of increasing importance nowadays, making sure that we are secure, and having everything hosted locally and within our own borders helps ensure that it is safe and trustworthy. Evolution is our main practice management solution. It is a complete solution, which is to say it offers everything ranging from admin, clinical, banking, reports, and more, all in the one system. So you don't need to be hopping between multiple systems in order to achieve those same goals. You can do it all from the one system. Manage My Health is our online patient portal and is a complete telehealth solution. It allows you to offer online appointments. It allows you to share health records with your patients or other doctors and specialists. You can provide repeat prescriptions and e-scripts, which allows for the storing or viewing of test results, and it also provides a secure Australian-hosted means for telehealth, whether that is an audio or a video chat. We do allow for video chat as well. Patients can also link their Bluetooth-enabled devices to allow monitoring. So things like Fitbits or blood pressure machines, they can be used to monitor the patient's activity or blood pressure throughout the day, just so that we keep on track of what the patient is doing and how they're progressing whilst they're being treated. So I mentioned earlier that our solution is customizable and it can be catered to suit your center's unique needs. You can choose the features that you need or want, and we also offer a server or cloud-based solution with a flat monthly fee. Care plans are a great way to help improve patient care as well as increasing patient numbers. With Evolution and Manage My Health, you will have the tools needed to make the process much simpler and smoother. Care plans, as many of you are aware, are the health plans set for patients who live with chronic conditions. They allow for better management of the conditions, leaving patients with a better quality of life and a greater sense of control over their health. Care plans may also involve numerous health professionals working together in order to meet the needs of the patients. And we just have some, I guess, reminders and some examples of very common item numbers used for the care plans there on the screen. Identifying suitable patients, collaborating with all the necessary parties, and the care plan itself can sometimes be complicated in and of itself. But with the right tools supporting you, it can make the whole process much easier, and that's where we come in. Our Evolution Management Solution and Manage My Health become invaluable tools. Our extensive reporting system helps to identify those patients with chronic conditions, and that would be well served with a catered care plan. From there, once you've identified them, you have a number of options available to you on how you can connect with your patients. We offer email and SMS services that you can send to patients to alert them to the fact that they are eligible for care plans, or you can send alerts to the doctors or specialists themselves. So when they see the patient, they'll be highlighted to the fact that that patient is suitable for a care plan, and then they can discuss it with the patient during their consultation. So it allows you to cater your approach to your patients. It's about offering options. During the consultation, you can discuss the goals of the care plan, the treatment, and begin creating the care plan itself. You can have the patients connect via Manage My Health. We have an app that is accessible either through their computer or on their smartphones, as well as some Bluetooth-enabled monitoring devices to track how they are going. You can connect with other doctors, specialists, or health professionals involved in the patient's treatment. This then leads to the ongoing management of the patient. Whilst the patient is being monitored, should any of their values lie outside of the desired range, the doctor can be notified to allow us to rectify any issues. Patient reminders can be set to remind patients of any reviews when and if they are becoming due. Patients can also book an appointment through the online portal should they feel that they need to come in earlier, or if they receive the reminder, they have that option to do so. Doctors and nurse reviews patient outcomes either via telehealth or in person. Repeat scripts can be given electronically where needed, and the patient has further options of attending consultations, helping offer more options for you and your patients. Reminders can be set to ensure proper continuation of care, and the cycle can begin again. So with the right tools, the complex process can be made much more manageable, allowing you to focus on your role and have you do what you love to do. Thank you very much for your time. That's it from me.
Thanks so much for that, Igor. Much appreciated. Hope you all got something from that, and it gave you some good ideas to get your patients onto care plans and getting the care they need. Now it's time for questions. I haven't had too many questions. You've all been very easy on me, which is lovely. Does anyone have any questions? Now, we can do it two ways, either through the chat, if you just put them in the question and answer section, or if you raise your hand, I can turn your sound on and you can ask the question in person to either Igor or Hanya. While we wait for questions to come on in or come through, I just wanted to let you know when you exit the webinar today, you'll be presented with a survey which has a couple of tasks. Firstly, it's asking you to rate the session so we can continually improve these webinars that we hold regularly. Also, it will be asking you if you have any suggestions for topics, what types of information can we deliver to you to help you improve your practice. And lastly, if you'd like any information on either Manage My Health, MedTech Evolution, or any of Hanya's goodies that she spoke about today, just tick the box and someone will be in touch with you. So I don't have any questions. No questions have come in. Last call for our questions. I don't see any hands raised. No. Well, you've been very kind to us. No one's going to ask any hard questions, which is good. We must have covered everything off for you. We will be holding another webinar in the next month or so. Keep an eye out on our Facebook or LinkedIn pages, which are Manage My Health Australia. And we'll put that, also put a link in the email that you'll receive as a follow-up with the recording of today's webinar and also copies of the slides. And if there's any questions after this session, please feel free to email us and we'll do what we can. Thank you so much for your time today, and a special hello to all of the practices in Melbourne that I know are going through a hard time in lockdown and wearing all of that PPE. So thank you for everything that you're all doing in the health sector. We appreciate it, keeping us all safe and healthy. And we look forward to seeing you again online at our next webinar. Thanks so much, everyone. Bye-bye. Thanks to our speakers also, Hanya and Igor.
Thanks, Karen. My pleasure.
Bye.
Thank you.
Bye.
Bye.